Welcome to the Sync podcast series, Stories in Health Innovation Through Interprofessional Collaborative Practice. My name is Dr. Tom Ryan. I am the former Executive Vice President and Chief Medical Officer for Mary Washington Healthcare and serve as the Sync Program Director. As we are aware, modern medicine has been evolving to rely more on interdisciplinary clinical teams and wider systems of care than on decisive individualism from any single professional group. Recognizing this trend and the gap in relevant training, we developed the Sync program, an innovative statewide partnership. The partnership includes the Medical Society of Virginia, the Virginia Hospital and Healthcare Association, the Virginia Nurses Foundation, the Virginia Pharmacists Association, and the Virginia Department of Health, and Community Health Solutions. This program brings together all members of an interdisciplinary healthcare team. Teams attend 6 half-day training sessions on topics of leadership, creative problem solving, 21st century healthcare, operationalizing interprofessional collaborative practice, and individual and organizational wellness. They are asked to come to the collaborative with a project idea unique to their organization and put their learning into practice by developing that idea. Project support is provided throughout the program from our knowledgeable staff. To date, 50 teams have participated in Sync and have tackled a wide variety of topics, ranging from the specific initiatives around chronic disease states, improving emergency room patient flow, to integrating oral health education into our patient offerings. There has been involvement of a great mix of teams from across the Commonwealth of Virginia and across healthcare practice settings, with a wide variety of disciplines represented. We will highlight some of the wonderful work that has taken place and lessons learned by interprofessional groups that have gone through the program. Our hope is that in sharing these stories, you will gain ideas, learn from the experience of others, and further foster the spread of healthcare innovation. Now, here is your host for the podcast, Steve Horan of Community Health Solutions.
Welcome to the Sync podcast. I'm Steve Horan with Community Health Solutions and part of the Sync support team. Today, we'll be talking with Marvella Rea, Medical Home Case Manager with Augusta Medical Group. Marvella represents a team of Sync graduates from Augusta Health and Central Shenandoah Health District. Welcome, Marvella.
Thank you so much for having me today. I'm anxious to talk about our project and a lot of the great stuff that occurred here at Augusta Health.
And it is great stuff. We're excited to have you, Marvella. So our focus today is your Sync capstone project, which was designed to improve prevention and screening for diabetes in the region served by Augusta Health and Central Shenandoah Health District. We're excited to learn more about how you made this project happen, but first, some context. The project actually came together in 2019, and you all did an excellent job of putting together a creative project, and it is up and running, and then the pandemic hits. And so, like everyone in health and community health, you had to pivot and rethink and reshape your strategy, and that's part of the creative leadership that you showed us. So we appreciate that context as you tell this story today. So to begin, why did you think it was important to focus your project on diabetes screening and prevention, and what were you aiming to accomplish when you started out in 2019?
So Augusta Health, we are a community not-for-profit hospital, and every 3 years we do a community needs assessment for our area. We serve the area of Stanton, Waynesboro, and Augusta County, and we had a community health needs assessment in 2016, and in that assessment we learned that diabetes, obesity, lack of exercise, these were all things that were problematic for our community. We, in 2019, follow-up community needs assessment, it was also noted that diabetes was actually one of the top 3 health concerns in our area. And many of the diabetics that we followed here through our primary care, through our hospital and other programs were actually people that were well into their disease process of diabetes. And we knew that to really help our community, we needed to start to focus on pre-diabetes and really get the information out there about diabetes in a much earlier stage and in a much earlier time frame for our community. And we decided that having a program already in place, our diabetes prevention program, was a good thing. But when we had the opportunity to do the SYNC project, we wanted to really step back and kind of relook at things, because for the number of diabetics in our community, which we knew from our assessment, we just didn't have the participation that we knew we should, and we wanted to improve that. So along comes SYNC, and it was a great opportunity for us to actually focus on the details of how we would begin to introduce that pre-diabetes concept to our community, to the providers, and more on a global basis than we had done in the past.
Excellent. And, it strikes me that your project was innovative in multiple ways, but here are three aspects that are really striking. One is you went upstream to think about pre-diabetes in addition to diabetes. And then second, it's a clinical community approach. And then third, it's healthcare and public health. And that kind of creativity and collaborative innovation is what SYNC is all about. And you are real leaders and teaching us in the SYNC program how to do this well. And so, as you've described, this project was a team effort, and we don't have everyone who had a hand in the project with us today. Can you give us a sense of your partners on the project, and if those were new or established relationships back when you started in 2019?
So this was actually an exciting part of the program. When I first learned that I would be involved in the program as a case manager, I was very well aware of the number of diabetics that we followed within primary care. So I was kind of on the outpatient. However, diabetes was really something that we'd spent a lot of time focusing on in the acute setting. And I actually came from that setting and had experience. So that was a good segue into it, because I knew both sides of that. However, the diabetes prevention program representative, Jean McGee at the time, who led that effort for a DPP, was basically between outpatient and inpatient, but maybe not as well known as she should have been for the service that she had to provide. And then the third partner that came in to the program with us was Amanda McComas. She was actually a nurse from our local health department. And very interesting, because most of the time, in my experience, we had not collaborated for a specific cause in the recent past. That's just not something that we had done. They're busy doing their thing. We have the acute care setting, we have the outpatient setting, but to really have three people come together and bring their expertise to the table from each perspective was very different. The other interesting thing for all three of us is that we really didn't know each other. We knew about what each other did within their job, but we had not worked together on any type of project or anything like that. So when we first met, it was actually kind of random the way it all came about. We had very much support in our organization from leadership, and leadership wanted a team to get together. and they were just trying to throw it out there and see, what would be a good project. Community health needs assessment was on the table. Diabetes always comes up because that's our number one issue within our community. And then I believe within our organization, each one of us was just approached and said, do you want to do this? And honestly, we kind of laughed because the first time we got together, we said, actually, what are we doing? So anyway, it was great. It was a new collaboration.
Yeah, it just sounds excellent, and it's a very common story. Especially before 2019, for folks to be working in isolation. But I really admire the strategic thinking of everyone involved. One thing that strikes me is you look to the community health needs assessment as part of the motivation for this. And then you brought people together across organizations, but even within organizations, across organizational units, and then, of course, on the team itself, across professional disciplines. And we're going to unpack that interdisciplinary piece in a couple of minutes. But before we do that, just to give us a big picture sense of your journey, as you went through the project together, what were the key action steps? And what are some examples of results to date? Again, remembering that you started this pre-pandemic, and then you continue that work during the pandemic.
So I think from an action step process, we really had to step back and think about what were the barriers to having patients in this program we already had. The program itself here at Augusta Health, the diabetes prevention program, was already in existence. We had to figure out why we had a low number of people in that program. So like I mentioned earlier, we wanted to increase the number of referrals. And we also wanted to use the screening tool for prediabetes, which really at that time hadn't been used. So as action steps, first and foremost, we needed to introduce the concept of the prediabetes screening tool and our DPP. We wanted to go back to primary care and say, DPP is a program we have here. We also had not used the screening tool, which the CDC and the American Diabetes Association had. So it's right there for our use at our fingertips, but we're not necessarily using it. So we rolled that out to primary care, and as an action step, let them know that we wanted to take some of the pressure off of the providers. One thing that we figured out right out of the gate is that we were depending on the physicians to, send us the patients. Well, actually what we figured out, and it's the whole push of the self-assessment tool, is if you start to educate your community and you start to educate your patients when they come to their provider, the self-assessment tool gives them the knowledge of where they are with their health. And so it's okay for the patient to be saying to the provider, what should I do? Do you have any programs? Who should I meet with? So we needed to take some of that pressure off. We realized that we had this program that was dependent solely on the doctor, which was unrealistic, because the other thing that occurs a lot of times when a person comes in for a visit, if they're ill or if they're hospitalized, you're really looking at the acute situation that is occurring. You're not thinking about a health prevention or picking up on something that possibly, in a pre-diabetes state, because there might be something more acute going on. So we figured out that from the very beginning. And as an action step, one of the things that we also wanted to do was we had these classes that the diabetes prevention program, the way it's set up, it was a class and they needed a leader to teach that. And we realized that we really didn't have enough of those. They're called lifestyle coaches. We realized that we could use our faith community nursing program to put information out about prediabetes. And we started to work with other people besides just the provider. And so those were huge steps in getting the information out there and just reinforcing a program that we already had.
There's a lot of wisdom in your approach. I'm taking notes here as you're sharing. You had to focus on patient engagement, which I think was creative. You had to focus on provider engagement, which still so often gets overlooked. How do we optimize workflows, the care experience for providers as well, so that they can do their best possible job? And then in the background of all of these projects, there's this thought about building on what we already have in place and making that better. That's very often the case in a sync project. And what that takes is true teamwork, and it takes not only workflow change, but culture change. And part of what I'm hearing here is that you had some culture change across the team and across the organizations. As people learn more about each other's capabilities, that creates new possibilities that allowed you to kind of accomplish these action steps. I'm going to go big picture now. One of our guiding principles in Sync is for teams to develop projects that deliver real value. So, Marvella, how would you describe the value of your project for the organizations involved and for the community?
So one of the things that was exciting along the way, we had a physician advisor who was very engaged in our project, who sees a lot of diabetics at a lot of different stages within their disease process. And she was very key in helping us design a pilot project where we used for 1 month the diabetes pre-screening risk assessment tool. And we just gave that to the patient. They filled it out very quickly. Basically, we learned in that quick pilot of 101 people, 30 knew they were diabetics, but 71 people did not know they were in a pre-diabetic stage. So we were able to show the providers that just doing this quick assessment could be of so much help to them, and it didn't take their 20-minute allotted visit to just talk about this. We have to figure out a way to help the physicians with they have time constraints as well. So that was huge in changing the culture of how people, at first they said, oh, another piece of paper, another assessment tool. And we were able to show with this quick pilot that no, we want to save time, not do something that's going to take more time. So that was a great thing that we were able to do. The other thing that was great for culture change for the physicians is not depending on them to send us the 10 patients that they had that needed to be in this program, but we actually worked with our IT, and we were able to get some reports that showed how many patients we had, what providers saw those patients. And so we used information that we already had in the system. And we also made a very quick way that they could refer patients in the system that they use. So those things helped. The other thing that is a culture change that has to continue with community needs assessment, we're actually just started doing another one because it was 2019. So every 3 years is making sure that we show that when we get that information, that we are developing teams and committees and working in a collaborative way to actually do something about what we find out. And that's very important, because if you gather information and then you don't take action, a lot of times that's not the way to change the culture. We have to show that this is something that we're really focused on, which we've been able to do that. So I think from a culture standpoint, also figuring out within our own team, this isn't as global, but even as the RN case manager or as the DPP person that was in charge of that, it was also very eye-opening to listen to our colleague from the health department to say, we're trying to work on these things all the time. We're screening patients too. I mean, I'm out at the county fair and I can do screenings also, which ultimately helps us all. Or how that really works together with having one of these classes at the local YMCA, because we found out through our, outside source, Amanda, that they're all trying to work on the same things. They wanted patients to be healthier. They actually had some programs on prediabetes, but we never sat down to really pull those together. So I think those were great things that helped us ultimately change the culture of the way we have to approach things in our community. I just think, as an aside, the hospital seems to be the main place that things are addressed, or it has been in the past. And as we move to a state where we're in a more preventative focus and wellness, it isn't just the hospital. It's just the opposite. It's everyone in the community working together to change diabetes, for example.
So well said. So well said. In listening, Marvella, it strikes me that you had to focus on value at every level. It's got to be valuable for patients. It's got to be valuable for providers. It's got to be valuable for the organizations, and it's got to be valuable for the community. And this project kind of very, very much focused on those 4 levels of value. And that's really key for creating this culture change you're talking about, where people who used to work in silos are now working together. So we really appreciate that. So Marvella, let's transition now from the big picture of organizational and community value to more of a focus on the teamwork aspect. One of our key themes in SYNC is teamwork, especially in the context of interprofessional collaborative practice. As you look back at the team coming together, what are some strategies that you use to bring people together and work collectively? And can you share a couple of breakthroughs or success stories that illustrate how that happened?
Yeah, so this was a great opportunity for our team. There were 3 of us, like I said earlier, and we had not worked together. We really didn't know that much about how each other approached this type of project. Through our SYNC discussions and our meetings and speakers and all the information, there were so many great tools that we were given. One of them was we each did a DISC profile. And so when we got together and we had one of our first meetings, things didn't flow as smoothly as we had hoped. And we really weren't sure why. We just didn't make the progress that we needed to in that particular meeting that day. And I think we all sensed that we weren't sure, like, okay, how to take the next step. And that meeting that we went to for SYNC that very next week, we were asked to look at our DISC profiles and see what our preferences are. How do we work together as a team? How do we like to get things done? What is the approach that each person likes to take? And it was actually funny because when we looked at it, we could not have had 3 more opposite people trying to take a first step of organization and how we thought it should be. And we knew there was a little something off. I had actually had a lot of leadership development and experience in the past. And so I couldn't quite put my finger on it, but I knew it just didn't flow as smoothly as I knew it should have. The other two people in my group, this was the first time that they had had this excellent opportunity to have this type of training. So when we looked at the disc profiles, I mean, it was great. It was great. It was something we talked about the whole time because it was such a breakthrough. And because of the training we received in sync, we were able to actually take that information and put it into practice. And then, I mean, since then, we talked about it after our project, how knowing those things helped us in our individual roles within our organization. Because developing leaders wherever they are in the organization is obviously helps us be more successful.
Yeah.
So that was very important. So that was a huge breakthrough that we came up with. Also, just some of the other leadership training that we got was very important, and it was something that we talked about throughout our project. Coming into a project where we each had a very specific way that we were focusing on diabetes, and all of us quickly realized that it was a team effort. You know, I was coming at it more from the hospital perspective. Our health department nurse was coming at it from the community perspective, and then we had our DPP program who was kind of in between the two. And what we quickly realized was that it had to be a collaborative approach, and each one of those was important, and none of them were more important than the other. So that was huge.
Really appreciate that insight and the way that you're presenting teamwork and leadership as two sides of one coin. And for our audience, the DISC profile, D-I-S-C, it's a widely used tool that a team can use to learn about yourself as a team member, but also learn about your team members. And you use that knowledge to learn how to work more effectively together. And there's often a lot of laughter involved. So I really appreciate that, Marvella, as people learn things they didn't know, sometimes about someone they've been working with for 10 years or more. So SYNC is a team-based program, of course, and we have an all teach, all learn philosophy. We deeply believe the faculty and the learners are all the same people. Everybody has something to learn. Everybody has something to teach. So in terms of your personal learnings, could you share a couple of personal insights or ideas that you've carried forward from your SYNC experience?
So I believe that it's very important to meet patients where they are. There's not a one size fits all. Their ability to take in where they are within the disease process, how they focus on it, maybe what some of the variables are to really being healthy. I think all of those things have been very important, especially during times when resources are very limited for people. With pre-diabetes, they, for example, start to talk about healthy eating. And there are some medications prescribed at times for people to take. And if a person doesn't have the resources to get their medications, or they don't have resources to eat as healthy as they would like to, then you really can't just keep talking about a program that requires those things. So what you have to do is you have to look holistically at everything that's going on for that patient. Maybe they need to fill out an application for Medicaid. Maybe they need SNAP benefits, which is a benefit where they would get access to more healthy food. There are so many variables that occur, and one of the things through this program that we've all really been focusing on is to look at all of those areas within a person's life to determine how much progress can they really make with their diabetes. And so as a result of that, we have actually developed more programs than we had when we started this program in 2019. So when we did that community needs assessment, we developed some really awesome committees that were going to focus on very specific pieces and parts of that needs assessment. And since that time, we have actually developed more with our food pantry programs. We even have a farm here at Augusta Health that grows healthy vegetables that we can provide to patients. And we've worked with local schools. We have just done the most amazing things as an organization over the last 3 years. We've gone out into our community to different shelters, and we've screened people for diabetes, and we've referred them to internal programs. And as a spinoff from this project, about 2.5 years ago, we actually started another program focusing on diabetes within 3 of our primary care offices, because we wanted to show in this pilot that a collaborative approach to this disease is the way to success. And involved in that was a physician, a registered dietitian, a health coach from our fitness program. We hired our first ever community health worker to just provide support and follow up. And then myself as a case manager, and then we have a case management model across our organization. So those are just a couple ways that we continue to focus on diabetes.
Thank you for sharing that, Marvella, because one of our hopes for SYNC is that the SYNC experience will be a catalyst. What we believe is that if you bring committed and creative people together to work on one project, the capabilities, the skills, the vision, the aspirations they develop will have a ripple effect across their organizations. And it sounds like that's happening. So thank you for sharing that with us. And thank you for sharing all of your insight and experience with us today, Marvella Rea. We know you are representing a strong and creative team as well. And we also thank Augusta Health and Central Shenandoah Health District for their support of this vital work on behalf of our Virginia communities. Thanks very much.
Thank you for this awesome opportunity.
We hope you have gained some new insights and ideas from the stories shared. To learn more about the next SYNC offering, please visit syncvirginia.org. That's syncva.org. There you will find more information, can view past projects, and contact us with any questions. Through the generous support of funding from the Virginia Department of Health's CDC, Living Well, and Innovate grants, there are opportunities for teams to attend tuition-free. See the site for details or contact us directly. Until the next time, this is Dr. Tom Ryan signing off. Thank you for listening.